Hey guys, Zach Carson here. We're going to be discussing some of the corrective exercises that you can utilize if you are having compensations in your foot and ankle, impairments with mobility or stability of that foot and ankle complex. In particular, talking about when the toes turn out or when the foot flattens down a little bit during the overhead squat assessment that we discussed earlier. So again, we want to make sure that we're going through 4 phases. We're going to first and foremost, we're going to inhibit, we're going to lengthen, then we're going to activate, and we're going to integrate. So again, we want to inhibit those overactive muscles and lengthen those overactive muscles as well. Then we want to activate and strengthen the underactive muscles, and then integrate the entire chain to make sure that we're getting that stability and balance incorporated into the exercises. So first and foremost, we're going to go into that inhibit phase. The 2 exercises we're going to talk about is the soleus, and then we're also going to work on the biceps femoris, the lateral aspect of the hamstring. So with the soleus, we want to make sure that we're focusing on the soleus, which is under the big heads of the gastroc. The soleus also comes in and attaches at the Achilles tendon. So really where the gastroc breaks right here, the soleus kind of starts before it turns into the Achilles tendon, and then you can also activate or feel it beside the knobby heads of the gastroc. For inhibiting it, we're going to go ahead and foam roll the soleus. We want to make sure that we start nice and low, right above where that Achilles tendon starts, and we want to make sure that we're not getting up and above onto that gastroc unless we are laterally or medially rotated to make sure we're hitting that soleus. Again, we can add pressure by putting that other leg on top of it, depending on your tissue, and we can also lift that butt up and add additional pressure that way. So again, we want to roll. Nice, short, easy rolling pattern, not going up on that gastroc, but rather focusing lower on that soleus portion. And also, if we want to rotate a little bit laterally, we can inhibit it there as well, or medially inhibit it there as well. Just trying to avoid the heads of the gastrocnemius. The second thing we can do, we can roll up onto the biceps femoris. Again, you want to kind of rotate a little bit laterally to make sure you're actually hitting that lateral aspect of the hamstring, which is the biceps femoris. We can do the same thing. We want to start from basically our ischiotuberosity, or our butt bone, where the glutes kind of come in, and roll it all the way down to the distal end where it attaches below the knee. So we're going to just roll all the way down and back up. Again, if you find any sensitive or trigger points, go ahead and stop on those areas, kind of release and roll through that pressure just a little bit. But you notice I'm also using a little additional pressure. I can push down with my hand to add a little bit of weight to that tissue, or obviously take the hand off, depending on your tissue sensitivity. Those are the 2 exercises that we're going to utilize for inhibition. Let's go ahead and talk about what we want to do to lengthen the muscles. So for lengthening the muscles, we're going to do the hamstring stretch and the standing tensor fasciae latae, or TFL stretch. The standing hamstring stretch is just the simple, every day that you've heard, stand here with your feet together, bend over and touch your toes. It's going to look like this. You're going to hold that for about 30 seconds. So what we're focusing on here is making sure that we're not compensating through the low back, because that takes the tension out of our hamstrings. So if you see somebody rounding that low back, then the compensation is coming through here. So you want to make sure that low back is nice and straight. You're keeping the hips kind of rocked posteriorly a little bit, and really focusing on that tension through the hamstrings. Once you find that mild discomfort, go ahead and hold. For the standing TFL stretch, you're going to take one foot over the other. So for this one, we're going to take our left foot, bring it over the right, and then we're going to take our right hip and we're going to push out to the side, kind of rocking our torso back to the left, pushing the hip out to the right, and then kind of either lean a little bit forward or a little bit back until you feel that tensor fasciae latae muscle right here getting a good stretch. So push the hips out as far as you need to until you feel that good stretch through that muscle. And again, holding for about 30 seconds on each side. So that is inhibit and lengthen. The next thing we're going to do is activate. So for activation, we're going to focus on two things. The first one is going to be a resisted ankle inversion. And you'll notice I'm putting the bolster under my ankle so that way I can make sure that I get full range of motion without inhibiting my ankle on the floor. So you want to take a medium-sized band, or about 20 to 30 pounds, or 15 to 20 pounds rather, of resistance. And these bands are color-coded. You can find the different weights of these resistance bands, or you can just ballpark it if you're using a towel or something along those lines. So you're going to take the band, you're going to place it around the feet here, or the foot rather, and we want to make sure that we are creating the resistance opposite of the way that we're going, and then we're simply going to go into inversion. We're going to hold it, and then we're going to slowly come back. The tempo there should be about 3, 2, 3. So 3 seconds in, 2 seconds hold, 3 seconds out. So about 1, 2, 3, 1, 2, 1, 2, 3. Again, important that you're making sure you're holding that resistance opposite of where you're actually pulling towards. The next one we're going to talk about for activation is going to be a resisted adductor stretch. So again, we're looking at a band that's about 15 to 20 pounds of resistance, or whatever that you're tolerating to. With this one, it's better if you have something to hold on to on this side to give yourself a little bit more stability and balance. For sake of the demonstration, I'm just going to utilize my own core stability and strength. But basically, we're going to take our leg, we're going to make sure that we're adequately abducted away from it, utilizing that resistance, and then we're going to adduct towards our other leg, trying not to rock the hips or bend over or make any kind of unstable movement patterns. So we're going to take that leg, pull it towards us, hold, nice and easy, return, working to strengthen those underactive adductor muscles. With that one, we're looking at about a 4-2-4, so if you can get that resistance, 1, 2, 3, 4, 1, 2, 1, 2, 3, 4. Obviously, you can toe touch as you need for balance, but again, if you have something to stabilize yourself, a bar, a box, a wall even, it's a little bit easier to pull that leg and release it to make that exercise a little bit easier. So the last thing that we do in that corrective exercise measure is we want to integrate. So we want to take all those things, integrate it up the chain, and make sure that we can utilize all those muscles accordingly. So for the two exercises, we're going to work on the box step and the star drill. So the lateral box step is again going to focus on the inside of the leg, or the adductor muscles, and it's going to be starting from this position. Hips are square again, our toes are pointing forward, we're stepping up on the blocks, again toes are pointing forward, we're not stepping into a medial direction or lateral rather, and focusing away. We want to make sure the hips are still square and that the foot is facing forward. So from this position, extend and return. Again, that return phase is just as important as the extension. We want to make sure that we're not just dropping out of the top of it, we're rather lowering ourselves against that resistance. So we're up and nice and easy back down until we touch, and we're going to go through that for 10 on each leg. The last one we're going to talk about is that star drill, and this is more of a single leg balance drill. From this position, we're going to go ahead and put our hands on our hips, and we're going to take one foot off the ground. For this one, I'm going to take the left foot off the ground, and we're going to go through 5 points, or the star, of touching the toe away from the body, focusing on the balance of that opposite leg. Integrate. integrating all those muscles. So all the points will be as follows: forward, forward left, left, reverse left, and then reverse. And you can kind of reach that toe a little bit further as you feel comfortable. Again, focusing on all that balance and stability, trying to keep those hips as level as possible as you go through this exercise. Again, you can see even my foot turning out slightly. You want to make sure that you try to keep that foot forward and not compensate through any of those dysfunctional movement patterns. So we talked about the 4 phases of corrective exercise, 2 exercises that you can do in each, making sure that you're utilizing each one according to the corrective exercise program that is listed. Thank you.